Hi guys. So we're going to talk about Darlie Routier again, and I'm just going to jump right into these myths versus facts because, like I said, I think these are so good. Some of these are really good and really interesting. And it might be broken down into a couple of videos depending on how much we talk about each one, but let's just get right into number one. No windows gave visibility into the Roman room where Darlie and the boys were. So while any attempts to ascertain the intruder's motive are purely speculative, one possible motive is that the intruder was a predator who may have been watching the Routier home. However, it has been argued by non-supporters that had there been a lurking predator, he would not have been able to see into the Roman room, the family room, and thus it would have been impossible for him to know that Darlie and the boys are in there. Below is an excerpt taken from James Cron's trial testimony. Well, on the inside, yes, I made several notations of mental observations, but nothing indicated an intruder. I noticed the blinds where you could see the interior of the house through the Venetian blinds, or, well, blinds that were covering the sliding glass door. Okay, and what could you see inside the house looking through the blinds from the outside? You could see the family room, or den, the Roman room, the interior. Cron was a retired investigator who was called in by the Rowlett Police Department as a consultant. The sliding glass door to which he was referring may be seen in the following photo, States Exhibit number 89A. And there it is. You can see, it's not very big, unfortunately, but you can see, looking through that with the blinds open, you could see right into the Roman room. And then if you go down, you can see the links to his testimony. So let's just go on to myth number two. Myth number two, James Cron did a thorough inspection of the crime scene before forming his opinion that there was no intruder. Retired investigator James Cron arrived on the scene at approximately 5:45 a.m. on June 6, 1996, and conducted a walkthrough of the crime scene in order to inspect the evidence. His walkthrough took him through much of the bottom floor of the house, including the entryway, the hallway, the Roman room, the kitchen, the utility room, and the garage. He then continued his inspection of the crime scene outside, which included searching the exterior of the house, the driveway, the backyard, the spa, and the fence. And here's some of his testimony, it looks like. Did that conclude your initial walkthrough? Yes. Do you have an estimate of the amount of time it took you to do the initial walkthrough, Mr. Cron? Well, 25 minutes, maybe 30 minutes. Were you under any sort of time constraint, or could you take as long as you needed? I could take whatever time I felt sufficient. All right, did you feel that you had sufficient time for that initial walkthrough? Just for the initial one? Yes. Certainly yes. All right, and let me ask you then. You finished your initial walkthrough of that residence, backyard exterior of the residence. Did you form any opinions after your initial walkthrough, sir? I was beginning to have some feelings about the offense, yes, sir. All right, what impressions, if any, did you start to form after that initial walkthrough? That there had not been an intruder enter through the window. Well, that is from your initial walkthrough. It's sort of a big picture. It's not any one thing. It was the overall scene, which primarily is the lack of evidence in many cases. But the entire scene indicated to me that there had not been an intruder. There wasn't any one object or any one situation there. Let me ask you, did you find the physical evidence there in the crime scene to be consistent or inconsistent with information you had been given by the Rowlett police officers prior to starting the walkthrough? Inconsistent. Cron stated that he took a maximum of 30 minutes to go through the crime scene. After that time, he formed an opinion that there was no intruder, which meant that he suspected an inside job and that one or more of the occupants of the house had committed the crime. On cross-examination by defense attorney Douglas Mulder, Cron said the following. Well, you made your verbal report when you got out there by the deck, by the back, didn't you? Yes, right. You were telling them, guys, this is what I think, there is no, hey, the die is cast. Right? Well, I told them after the walkthrough, when I came around the front, I said, look, we have no intruder here. Yeah, right. That was my verbal comment. That is Lieutenant Cron's analysis. After what he did, what did the walkthrough take? 20 minutes? 20 or 30, yes, sir. 20 or 30 minutes, okay. What Cron's conclusion after just 20 minutes, 20 to 30 minutes, and he made the conclusions known to the police officers, the younger, less experienced men who had called him in for his assistance and expertise in the first place. The following quotes are from the TV shows in which Cron talks about how long it took him to reach the conclusion that there was no intruder. There's a nice picture of the house. Yeah. It was about 30 minutes into the scene that I felt like someone in the house had committed the offense, not an intruder. James Cron at 504 Women on Death Row. I began about 30 minutes, and the Rowlett police did too, that we felt there was no intruder. James Cron at 509 True Crime Scene. I'd say within about 30 minutes I felt like something wasn't right. James Cron, 48 Hours Mystery. We didn't start looking at the mother till 20-30 minutes in when I told them I said something's wrong with this scene. James Cron at 539 Mugshots. 20 to 30 minutes, he has already decided that the mother is responsible. So that's very quickly he's made up his mind, and then you can see there are links to his testimony about this. Now, let's go on. Myth number 3. How serious was Darlie's surgery? Darlie's surgery was no big deal. Her injuries were minor. Non-supporters claim that Darlie only sustained minor injuries and that her surgery was not a big deal. However, by examining what the doctors and nurses said on the stand, it becomes clear that Darlie received urgent medical attention at Baylor University Medical Center. Below are excerpts of trial testimony from various medical staff. Nurse Joy Fitz. Fitz was a nurse who was present in the emergency room when Darlie was brought in. And then we got a second call saying that we would be getting a second patient, a female, the mother of the child, that was awake and talking. Okay, what did you do in preparation for that? There were several things that we have to do. There's a lot of staffing situations that we have to do. Each major trauma patient gets 2 nurses assigned to them immediately. And we have to actually don garb. That is our trauma gear that covers and things and glasses, things to protect us from different things. And there's equipment, IV bags, and any kind of equipment we may possibly use. We set it out. Did you get ready in time to receive the female victim? Not as well as we would have liked to. We only had a couple of minutes notice for the lady that was coming in. Describe her physical condition when you saw her in your trauma room. She arrived me completely nude, covered head to toe in dried blood. She had a dressing around her neck and around this right arm. Okay, what did you do then? We immediately take them off the stretcher. You've got to understand it was a very stressful situation. It was a horrible sight to see all of this. We get the people lowered onto the table. We have technicians start bathing them, washing them down. We need to assess what their injuries are right away. So as soon as she got over, the technicians there were taking off the dressings off of the arms and began taking the dressing off the neck here. Okay. And the paramedics were giving us a report about what the injuries were. Her neck was bleeding, is that right? Her neck initially was not bleeding. We pulled the dressing off. It was initially not bleeding, but the surgeon had to explore that wound just a little bit and look at it. And after he had touched it just slightly, a bit of blood squirted out of the wound, which would, to us, indicate an arterial bleeding, and that we don't want to mess with that in the emergency room. So we immediately covered that back up. All right. Was she in there any great length of time? She was. I had her in there exactly 13 minutes. Okay, and did they take her off to surgery? Yes. Dr. Patrick Dillawn, sorry. Dr. Dillawn was a resident doctor at the hospital. He was also in the ER when Darlie arrived and participated in her surgery. And at my initial examination, she was covered with blood. She appeared to have a stab wound on her neck, which was either She or one of the techs was holding pressure on it with a gauze bandage. Okay, how long was she there in the emergency room? I know this from the record. She was there for 13 minutes. Pretty quick time. That's a very fast time. Okay, Dr. Alejandro Santos. Dr. Santos was a physician at the hospital. He had worked on Damon and then operated on Darlie. He first saw her in the ER. I had been notified there were 2 stab victims coming in. One was a child and one was an adult. As far as what happened, you're not given that type of information. No? Okay, so what do you do to get ready to receive those 2 stabbing victims? Most of the time we prepare, we have several trauma rooms to take care of the trauma patients in. We usually call the trauma surgery residents to come down and help. I just happened to be in the emergency room at that time, and the residents happened to be in the emergency room at the same time caring for other patients. So we prepared for these 2 patients by getting 2 trauma rooms ready. After you pronounced Damon dead, did you go and see about the other stabbing victim? Well, actually, before I left the room, the other resident that was in with the adult patient came in and said she needs to go to the operating room. So after I pronounced the child dead, I left the room and went to the other room to see the adult patient. And what was going on when you went into that room? There was a lot of people in the room. There was a lot of commotion going on, but I got a chance to see her. She had a laceration to the neck with a lot of blood on her chest and her body. I agreed with the surgery resident that in view of those injuries, we needed to take her to the operating room to explore the wounds. Describe the wound you saw to her neck. When I walked in the room, she had a slash wound or a laceration to the neck, kind of tangentially going from the right side to the left or left side to the right across here, across this area. So here. Actually, it would have been the other way, like this. Across her neck, and I said she had a lot of blood on her because the residents had already examined her, and based on my quick evaluation at the time, I felt it would be best managed up in the operating room. Okay, tell the jurors why it's best to go immediately to the operating room with that type of wound. You don't want to take any chances with any type of neck wounds. There are a lot of vital structures in the neck. The vessels that feed blood to your brain and vessels that bring blood back to your heart, as well as your trachea, the voice box. All those kinds of injuries can be very devastating if they're not taken care of right away. So it's usually better to go examine those in the operating room and get better control in case you get into trouble. All right, were you in there and helping with in the performance of the surgery? Yes, I was. Okay, describe for the jurors what type of surgery was performed. Well, it's called exploratory surgery, again, because we're looking for injuries. We don't know what's injured yet. We took her up to the operating room, gave her general anesthetic where she was out. We washed the wounds, cleaned this all out, and were able to look at it. Once we had her up in the operating room under the anesthetic, with everything cleaned and prepped, there was very little bleeding at this time. So we explored the wound and found that most of the bleeding had come from the veins that are located under the skin and kind of in what's called subcu, or the fat tissue that's underneath your skin. There's a bunch of veins here in the neck area. Some of those were injured. We repaired those by either using electrocautery, which is an electric type of current that coagulates the vessels, or we put some stitches in the small vessels. We washed out the rest of the wound. We noted that the wound went down to what's called platysma, which is the muscle that kind of covers your neck here. When you do that, you can see it flexing. Her wound went down to the platysma, had a little nick in it, but did not go beyond it. So having found that extent of the injury, we washed that out and closed the neck wound. And could you tell the jurors how long this wound in the neck was? We didn't measure it, but we estimated it was approximately 9 centimeters long. You say it came across partly on the right side? It went from right to the left. I can't tell you where it started, but it extended from one side to the other, just past the midline on the left side. Now you say that it went to what's called the platysma, is that right? Yes. And did you measure how deep the wound was? No, we usually don't measure wounds because it doesn't matter the depth of the injury. What matters is in relationship to the other structures, like the platysma. in the neck, and that's kind of a defining boundary. If it goes past the platysma, it's considered a deep wound. What did you do to repair the wound? As I said, we washed it out and made sure that the bleeding was controlled, and then we put some sutures in there to close the wound completely and put dressing on that. Okay, so you made sure the bleeding was controlled from the veins that were cut. Witness nodding head. And then just sewed. Did you sew Miss Routier up? Yes, we put what's called a something stitch under the skin, but we closed the wound up completely. Okay, now could you tell the jurors about the other injuries you looked at? Yes, she also had a separate laceration or wound to the left shoulder and another one to the right forearm. Those were not actively bleeding. Those were not our main priority when we got into surgery. Once we determined that the neck wound was under control, we finished and closed that. Then we turned our attention to the other two wounds and washed them out. Determined that there was no foreign body left in there, like a piece of glass or a piece of metal from the knife, whatever had caused the injury. We determined that there was no active bleeding. Again, cleaned them out, washed them out, and then closed both of those wounds. Okay, now doctor, after she was sewn up and these wounds were cleaned up, what did you do with her then? After that, she was extubated, which means the breathing tube was taken out, and we put her in an intensive care unit for recovery. Can you tell us how long this whole procedure took to look at these wounds, the whole operation? I could look it up if you want the exact time, approximately an hour, hour and a half. All right, now you transferred her to the ICU unit. Where is that located in Baylor? In Baylor, it's located up on the 4th floor. We have a number of ICUs. She was taken to the trauma ICU, which is on the 4th floor. All right, well, let me ask you, doctor, maybe in the discharge record you used the term, the discharge summary, that she was emergently taken for neck exploration. I'm assuming that emergently means with all haste? Correct, yes, sir. Dr. Santos said that if Darlie had not had the neck wound, the doctors probably would have sewn up her other wounds in the ER and sent her home. But she had a potentially life-threatening wound and was rushed straight into surgery. Time was of the essence, and Darlie had lost a lot of blood already. And there's a picture of her in the hospital. States exhibit number 52G, showing her after surgery. Darlie was brought to the ER by ambulance. The paramedics called the ER ahead of time and told them that they had a trauma patient, so the medical staff got a trauma room ready. Darlie arrived covered in blood from head to toe, and the neck wound was examined and touched. Blood squirted out, indicating possible arterial bleeding. Darlie was in the ER for just 13 minutes and was then emergently taken into surgery. Non-supporters have described Darlie's injuries as mere scratches, but this was clearly an emergency situation. And then, of course, there's the testimony that you can read if you like to. All right, maybe we'll do one more. Oh, this is a good one. Damon, sorry, myth number 4, Damon could not walk or talk after receiving his injuries. I've heard this one a lot. Darlie testified that Damon spoke a few words to her and followed her a few feet across the Roman room after he had been stabbed. Non-supporters, however, claim that due to the severity of his wounds, Damon could not possibly have walked or talked after being stabbed, thereby contradicting Darlie's story. Below is testimony from Dr. Alejandro Santos and Janice Townsend-Parchman regarding Damon's mobility and audibility after being stabbed. Dr. Alejandro Santos. Okay, if you've seen people in the ER that have been stabbed and had a collapsed lung, is that right? Yes. On a few or many occasions? Many. Okay, if someone is stabbed in the lung and it causes it to collapse, are they still able to make noise? Yes. Okay, would they still be able to cry out in pain? Yes. Okay, and is that a normal reaction when you get stabbed? Really? Yes. Okay, People make a lot of noise there in the emergency room, I bet. Yes, they do. And is it an instantaneously fatal wound? No. To have a collapsed lung can cause some pain and discomfort and shortness of breath and trouble breathing, but it won't kill you. If you get what's called a tension pneumothorax, there's a lot of pressure in your lung, or actually outside the lung, and pushing your vital organs, your heart and all of that over, that can cause your blood pressure to drop, and it may cause death eventually. But he did not have a tension pneumothorax because it was open to the air. A tension pneumothorax usually is a closed system. So when he was stabbed, he would have been capable of yelling out in pain? I believe he would have, yes. And he would have been capable of moving around some? Yes. Dr. Janice Townsend-Parchman. Okay, doctor, I would like for you to assume for a moment that this child had received all 4 of these stab wounds at one time. Okay? Do you have an opinion whether or not this child could have remained mobile and could have moved on his own, say 10 to 15 feet? Yes. Okay, what is your opinion? He could have. I would like for you to also assume that the child again had received all 4 of these stab wounds at one time. Do you have an opinion whether or not this child would have had the ability to make noise, to be audible after receiving all 4 of these stab wounds? Yes, he could have. Therefore, according to the above testimony, there was nothing precluding Damon from walking or talking after being stabbed. The claim that he would have been unable to is not supported by the medical testimony. So that's a pretty good myth. That, like I said, that's one I've heard a lot. So there's the links to the testimony if you want to read those too. And I'm going to put the link to this Facebook page down in the description so that you can read these. Like I said, I'm probably going to do another video with more of these myths. There's a lot of them, so I think these are pretty good and give us a lot of information on these myths that could be helpful in deciding whether or not we think that she's guilty or innocent. And like I said, this is the sort of thing that that we need to listen to also, not just the other side who says guilty, because like I said, I really don't think she is. And these myths versus facts are great. I've been looking at these for days and just amazed by some of these. So yeah, anyway, thanks for watching. Sorry, I'm losing my voice now, so it's a good time to stop.